Our friend Dr. Deborah Birx, White House coronavirus response coordinator under President Donald Trump, and specializing in HIV and AIDS immunology forever and ever and ever, and vaccine research and global health, and a veteran and an amazing resource. We thank you for your time.
Thank you. Happy to be with you all.
And it's nice to hear you because I assume you wear some sort of protective suit all the time, continuing your specialty. It's not like you could just go to work in shorts and a T-shirt.
Yeah.
No, I use data to know what risks are out there.
Okay. So you say. Mm-hmm. No, you are always a delight, and we thank you. All right. So this new talk of the return of COVID, obviously COVID never went away. It's going to be a part of our lives going forward. But how big a deal is this new variant, and what's your take on it?
So let's start with where we are now. This is the fourth summer where we've had a summer wave. I know most people are not aware of it because it's primarily across the South. It's primarily in people over 70 that are being hospitalized. But we're only measuring hospitalizations and some random wastewater. So we don't have eyes on the virus anymore. So the current variant that we have, we're not that worried about because the past vaccines have covered it. But the new variant that we're beginning to detect, and we have no idea how prevalent it is because we're not sampling adequately enough, will escape much of our previous immune response from having natural infection or vaccination. And that's why everybody should be concerned, because we ought to be talking about remaking our fall vaccines right now.
And is anybody doing that?
No.
Oh,
so this is my issue. If you're going to monitor what's happening around the globe, then you should be using that data to really create the vaccines that we could need in December and January. And let's just quickly, for your audience, what has been happening is the waves have been coming a little bit later. And that's because it takes us about 6 months to lose significant immunity protecting against infection. So the winter wave of 2023 came in January. Mm-hmm. So the summer wave is now in late July, August. So the winter wave for next winter will probably be in the January, February timeframe, which gives them plenty of time to remake this vaccine to be ready in case this variant, which currently escapes a lot of our immunity, becomes prevalent in the United States.
Well, you know this business better than all of us. Why not do that? Are you, there's got to be people in that supply chain, in that decision room deciding to do that. I mean, is it as simple as it's a money thing and they've already spent it, or what do we not know?
You know, it's so interesting to me because I was listening to your segment on the hurricanes, and look at the amount of money we have invested in understanding hurricanes and modeling them and their movements and giving people enough warning. And for infectious diseases and these viruses that are killers, we're not investing that same effort. And believe me, people know what to do. So if you tell them that within the next 2 weeks, the elderly over 70 need to be protected, people will do that. Mm-hmm. But we're not monitoring it in a way that we can actually give people that information where it could make a difference. Because right now, if you're monitoring only hospitalizations, it's too late. There's already incredible community spread before you get the hospitalizations of people over 70. So you really have to find an earlier warning system that's more precise than wastewater. Maybe it's monitoring elementary schools' wastewater. There are ways to do this with precision that would give us clarity on whether it's RSV or whether it's flu and whether it's COVID, so we can warn people over 70 what they need to do for the next 2 to 4 weeks to be safe.
Dr. Birx, it's always so great to have you on. And we talk a lot about being proactive when it comes to our own health, and that is getting the baselines when we're worried about ourselves, so we know that we don't get sick or we don't get this disease. We know what's going to be coming up. We would think we would do that when we know that this virus may come back, may affect somebody that you know. This new strain, what is it called? Because now I've lost count because there's been so many. And when you talk about vaccines, when it's coming out in September, should it just be the folks over 70 that are more interested in getting that right away?
Great questions. So the new variant is this BA 2.86. And why is the 2 important? Because it delineates that it's coming from Omicron, but we know old Omicron, but highly mutated now. And that's what viruses do to get around our immunity. They need, in order to live, they need to take over our cells so that they can reproduce themselves. And they can't take over our cells when we have pre-existing immunity. So we know that these viruses constantly try to escape our immunity so they can infect us. Now, the problem with this new variant is we know, at least in the laboratory, that the current immunity that we have from our own infection and vaccines may not be effective. Who does that impact? Everybody who's on cancer therapy, immunosuppressed people, and people over 70. And the problem is today, as it always has been, is young people do not get symptoms and unknowingly are passing this virus on to their grandparents and their great aunts and accidentally infecting them. Now, we know how to prevent that, but we have to warn people, and we're not really putting the systems in place that allows the young people to know when they need to protect their elderly.
Well, you're talking about a problem that is fixable if people take the proper steps to fix it. But unless I'm misreading you, here's what I know. The House controls how money is spent. Is this literally something that the House is refusing to take on because of the election cycle we're in?
Well, COVID doesn't poll well.
Right.
Things don't poll well. People are like, oh, well, the American people are disinterested. Well, the American people are disinterested at current rates. But if their grandparents start dying again, they'll be highly interested. So the government and the federal government have the resources. They just need to tell the companies to make this new variant, because the companies are going to get paid for the vaccines this time. So the federal government doesn't even need to invest money. They just need to call up Pfizer and Moderna and say, you know what? We want you to make this new variant. We want you to have it ready in January. We know that you're going to make it at risk, but you've made a lot of money off your COVID vaccines. And we believe this is important for the American people. I believe that the private sector will be responsive. They're the ones that helped us back in 2020 when we had no tools.
Right.
They're the ones that made the monoclonal antibodies, the vaccines, the remdesivir, everything that we had and all the tests came from the private sector. Yes, the federal government invested. Now the private sector has plenty of resources. They just need the federal government, the FDA, and the CDC to say, you know what? We're worried about this new variant. So we want you to make a vaccine now and have it ready by January.
All right, we have to do some more with you. Can you hang for a sec?
Yes.
Thank you. Dr. Deborah Birx, more on the threat of a new wave of COVID and the inaction being taken. That's just maddening. In the meantime, Dr. Deborah Birx is with us. So getting back to where we left off in parts and pieces?
That's fine. Parts and pieces. Peats and parses.
Dr. Birx, you may need to translate whatever I'm using as English here. But if we know that something can be done and it's not getting done because maybe it's not politically expedient, my reflexive response here is to tell your elected reps, unless you get behind this, you can count on me not voting for you. I don't know how else to spur people into action other than to recommend that.
Yeah, I think you had a really great question on who's still at risk. And who's at risk, people over 70. Let's remember that these vaccines...
Well, it's in all of the United States Senate then.
These vaccines are not durable for protection against infection. That wanes very rapidly, sometimes within weeks. And so just because you were vaccinated doesn't mean you're not going to get infected and pass the virus on to people who are vulnerable, like people over 70. So imagine if today we said to the companies, please make this new variant. We want to immunize people over 70. They only need one dose. We're talking about 35 million doses. That's nothing for these companies. If we asked them to do it, I believe they would do it. And I just loved your traffic report, because that's what we're talking about, giving people information, empowering them to say, okay, there's this new variant is in your area. Make sure people over 70 are immunized. If you want to be super protective of them, make sure that you're not seeing them when you're infected. That does involve testing, or it does involve masking during a surge, not every day, but during a surge. But give people the information that they need to have so that they know that there's virus in their community. They know who's at risk. After 4 years, we know who's at risk, and make sure that we're doing everything that we can to protect them. People over 70 are valuable. They're actually
100%.
Absolutely.
Yeah, and Nick, I think that's the only time that anyone has ever said that they loved your traffic report.
Most people hate the traffic.
And it was valuable.
So I guess I'd equate it with this. If you're, hanging out with your grandparents and you're on a corner of Michigan Avenue and whatever, you don't shove them out into traffic and see what happens. So if you can protect them, why wouldn't you try in time of surge? It doesn't mean your rights are being restricted. Let's not go down that same tired path. It's just doing the right thing and possibly making a difference. That seems like a simple ask.
It's very simple. And I know people, particularly our young people, I found our Gen Z and our Gen Ys and Gen Xs to be very responsive if they're given the data. So you just need to tell them, like the traffic report, like Monday morning, say, we have a lot of COVID in our communities right now. This new variant is particularly damaging to people over 70. And let's be very clear, getting admitted to the hospital with COVID is not a benign thing for people over 70.
Sure.
So even if they don't die, they get significantly debilitated, and some of them never get back to baseline. And I know you want your grandparents and your great aunts to thrive. So we have the tools that every American can thrive. Let's make sure people have the information that they need. And let's ask our pharma companies to make a vaccine to the new variant for people over 70.
Doctor, how in real time is the data, though, that we're going to get from, let's say, the CDC, so we can pass those numbers on? What's the lag time, the delay?
So thank you. That's the real problem right now, because we used to know, because this virus is very, very understandable. Starts in young people, usually people in elementary school, high school, gets into their parents, and then gets into the elderly because of the care provision of many of our elderly. Remember, 95% of our elderly live in multi-generational houses or in the community. They're not in nursing homes. And so we know how this virus moves, but now we're only detecting in random wastewater with that. I mean, the number of wastewater sites we have is not adequate or defined enough so that you could really say that this is important right now. And we're watching hospitalizations. But by the time you see hospitalizations, the virus has been spreading widely in the community for 3 to 4 weeks. And so we need, like hurricanes, we need to know when the hurricane is in the Caribbean, right, and what the characteristics are, so we can give people a week or two notice. And we've taken all those systems down, and we can't warn people anymore.
Yeah, it's a great point. The hurricane analogy is a great point. It's not like you go, more of this hurricane talk. That's the last thing I want to hear is about another hurricane. No, you'd like to know if the trouble's coming so you can appropriately react.
Correct.
Dr. Birx, so I've read this. The increases in COVID-related hospital stays are connected to somehow these antibiotic-resistant infections. And pharmaceutical companies very well. So in general, these antibiotic-resistant infections or antibiotic resistance can be a threat, really, to public health. So what are these companies doing to improve therapies to help?
Man, is there an easy way to explain the link?
And is there an easy way to say what I just said?
Yeah, no, you're absolutely correct. And that gets into what we just talked about. When people go to the hospital with severe COVID, they're debilitated. When you're debilitated, your immune system is not working well. And remember with HIV, when people got late stage disease and their immune system wasn't working and it was crippled, and you get what we call opportunistic infections, infections that would not normally infect a person who had not been through a crisis. And COVID-19 infection and hospitalization is a crisis for that individual, puts them at higher risk for both fungal infections and weaker bacteria and bacteria for which there may be significant resistance. And so we're seeing spreading of funguses across the country, as well as increasing microbial resistance because of two things. One, hospitals are still stressed because of the number of personnel and human resources that they need. And the fact that COVID and the debilitation from COVID is causing a lot of additional hospitalizations, even in post-COVID, when those people get heart disease and diabetes and other issues related to their COVID infection. And so we're seeing a deterioration overall in the health of our individuals over 70. And so you're going to see this continue to increase. We don't have a lot of new options on the table. We just had a new antibiotic approved by Entasis, but we need a lot more antibiotics. I think many of you know I'm starting to work on phage now. It's a new way to actually kill bacteria in a targeted way, just like we're working in cancer. And so those are the kinds of new frontiers that we're going to have to explore, because it's not going to get better. It's going to get worse.
Dr. Deborah Birx, amongst all the other things she's done, author of the book, Silent Invasion. We thank you for your time. We know how busy you are. We hope your family's well. Stay healthy, and we'll talk again.
Thank you.
There you go. That's getting the word out right there, boys and girls.
She's good.